When you look around, there is not much choice. Our people are fighting diseases they shouldn't have to fight. With the Vitalist Systems Change Grant, we get to improve our communities.
It was an old tree farm back in the 80s and 90s, and we kind of restored it back to its agriculture roots. Took a lot of work and effort to get there, starting very small, but now we have about a 3-acre garden growing healthy food for the community. Through the grant, which is creating food hubs, now how do we take what we've learned and bring it to people where they are and inspire others to do the same? We want it to be adopted by the community, kind of create its own system. This is our first food distribution as a coalition. So yeah, this is the beginning. We have 7 coalition partners, including ourselves.
The coalition is uprooting diabetes from the San Carlos Apache Tribe. A lot of us, we are different partners from different branches, nonprofits, and funders throughout Arizona to really help support and build the vision that we have here
into bettering the food system in San Carlos. You can't do that alone. Even if you are, the best at what you do, someone else is also doing something in their lane that can be a value add. So we are certainly better when we work together.
Like, it's just kind of impacting the people at the community, at its whole, at its heart, and just being there for them, listening and supporting.
One of the greatest challenges is access to food, not having healthy food choices available. Those are some of the greatest needs that we see and we're trying to address.
For example, I was doing one of the food demos and it was just fresh fruits and vegetables and we were making little taco faces. And I was like, oh yeah, you could just do this at home. You just get these ingredients. And then the little girl looked at me and she said, well, I don't have these ingredients at home. It made me check myself because I was like, that is a real issue. Like, some people go home and they don't have fresh fruits and vegetables or any food at all.
We're all stuck in survival mode right now. This is systems change work, and that's where we have to really uproot the people from their traumatic stuff, holding them down.
The systems change we're making is gathering those resources as a community and a state level and get it closer to people. So we want to get into neighborhoods, establish community hubs in every district in San Carlos.
Changing a system, it doesn't happen overnight and it doesn't happen alone. So we do need that nuance and flexibility to kind of go where the wind takes us and be able to pivot resources if we encounter a barrier that we didn't expect. Snap Online was weird and elusive really until the pandemic. Although it's been in a farm bill in some version for the last decade, it's not something that we really had a good understanding and grasp of. So to go and work and build the trust with Vitalist and say, we don't know what this is, but we know it's integral and vitally important to the future of Arizona, help us get there, and for them to work with us has been absolutely incredible and truly unlike any partnership we've ever had as an organization.
For me, I think system change means not just for community, not just for inpatient, not just for outpatient, but multidisciplinary for all of these areas. Because if I don't have the primary care physicians involved in what's going on, then they don't know what's happening and they don't know how to help their patient in that way.
We see that there is a need for us to uplift and build those healthy foods, that food is medicine inside the people.
If we can get the resources and the food and the expertise closer to the people that need it, we believe that could create the systems change and inspire others to develop a system that is unique to San Carlos.
The systems change grant is just that.
Bringing clinical and community together.